thank you all for attending the CUSA Youth Soccer Association meeting we have today. We have special guest Chris Clark. He is our certified athletic trainer for Southside High School. He's also an adjunct professor at Jacksonville State University, where he teaches kinesiology as well as basic athletic training. He has a special interest in concussions, specifically youth concussions in sports. Chris has two young boys that are both actively involved in youth soccer, and he is very passionate and educated in the area of concussions. So I'd like to present to you Chris Clark, and thank you for coming.
Thank you very much. All right, I just want to thank you guys for the opportunity to come out and speak today, and I want to go through a quick PowerPoint presentation just to help you guys, help us all understand a little bit about what concussions are and what they mean to us. So I just want to start, we're going to talk about a few things. First, we're just going to introduce concussion and what a concussion is. And then we're going to look at the education of concussion, because I think education is the most important aspect of concussion. So we're going to look at education. We're going to define what a concussion is. We're going to look at some examples of how we recognize a concussion, how we manage a concussion, and different things like that. So we'll look at some research and some different things that help us to explain what a concussion is. And then lastly, why should we care about concussion? So we're going to talk about that today. All right. A few disclaimers. I'm an EDD student, doctoral student at St. Augustine for Health Sciences. I'm an athletic trainer for a local high school, obviously here at Southside High School, and I work at Northeast Orthopedics in Gadsden. This is a project for youth soccer coaches, and you guys all are CUSA soccer coaches, which is the league that we're going to work with today. And this course this topic is being filmed for a project within one of my classes for my doctorate degree, and you can see the class and the professor right there. All right. So briefly, let's go through the objectives of what we want to accomplish today. We're going to keep this kind of simple and short and to the point as best we can. We're going to define concussion, and we're going to tell what a concussion is and describe it a little bit. We're going to talk about what it is and what it is not. And there's a lot of misnomers about what a concussion is. All of us growing up, playing sports, doing different things, we've learned and found different things based on research that we've had through concussion over the years. So we're going to talk about that. I'm going to give you some brief facts. Again, I don't want to overwhelm you with research and different studies and different things like that, but I do want to give you just some basic numbers. We're going to talk about the media coverage, and all of us know how important media is, and this is obviously a hot topic in today's society, so we'll talk a little bit about that. We'll talk about the signs and symptoms of a concussion, and most all of us know those, at least have a good idea, but I want to make sure we talk about signs and symptoms. We're going to talk about the occurrences and the risk factors. All right. Then we will talk about how we manage concussions, and in particular, we're going to talk about the pediatric population, because concussions are a little bit different with pediatrics than they are with other populations. And we're all mainly dealing with 5 to 10-year-olds. CUSA does have leagues that go up a little bit higher in age group, but we're concentrating on that age group right now. And then lastly, we're going to talk about some current issues with soccer in particular, the U.S. Soccer Federation, and we'll talk briefly about the CDC Heads Up training program. All right, so let's begin by defining a concussion. So here's a picture of your brain, and a concussion is defined as a brain injury. All right. And it has a complex pathophysiological process response affecting the brain. All right, and it also is induced by biomechanical forces. And that definition is from the Zurich Consensus Statement. And the Zurich Consensus Statement, which was last done in 2012, is one of the annual conferences that is used in concussion education and management and everything like that. So there have been 4 different conferences over the last 15 years or so about concussion. So this is the foremost experts in the field of concussion. And I would like to say real briefly about the definition. The definition of concussion is not standardized across the board by all disciplines. You can see and read in different articles by different disciplines that are going to have a slightly different definition. All right. So that's the working definition we're going to go with today. Next, I'd like to talk about what a concussion is and what it's not. I want to start with what it's not, because most of us were probably under the assumption when we were growing up, oh, you got my bell rung. You hear that all the time. That's the number one thing. Oh, you got your bell rung, and shake the cobwebs out, different things like that. So that is no longer, research has shown that we don't want to use those terms, and we don't want to use those terminology. So concussion is not a bruise or just a contusion, okay? And it's not something we can just dismiss and think it'll go away and hope it'll go away. It's our responsibility as coaches, as athletic people, as teachers, as whatever the case may be if you're here in this room. It's your responsibility to organize and understand what it is to have a concussion. So what is a concussion? A concussion is a low velocity injury, okay? It causes the brain to shake. It results in clinical symptoms, okay? And it has a subset of it's a subset of a traumatic brain injury. Now, like I said earlier, there's a lot of definitions for concussions, and one of the primary ones is traumatic brain injuries. And different people and different associations define it a different way, but obviously it's an injury to the brain. One quick point and very important point to understand about concussions: concussion is not just when you get a blow to your head, okay? It has something to do with some other things like that, and we'll talk about that when we get to it. But that's a misnomer of concussion, is just that you have to have your head hit in order to have a concussion. All right, so some basic facts about concussion just to orientate everybody. There's an estimated 1.6 to 3.8 million concussions occur each year in the United States. That is from the NATA position statement in 2014. Some other facts: data from ED visits show about a 62% increase in ER visits relating to concussion from 2001 to 2009. So obviously this is something that is much more prevalent and it happens a lot more often today. From a college standpoint, the NCAA has research there that's shown that it's doubled from 1.7 to 3.4 concussions per 1,000 athletic exposures. All right, that research was done in 2007, so obviously that number is probably a little bit different these days. And if I had to guess, I would say it would definitely be a little bit higher. Okay. For high school sports and youth 19 and under, it rose from 150,000 to 250,000 treated individuals between 2001 to 2009 in ER departments, and that was research done by Gilchrist and all in 2011. And and then the youth area has not been studied very well. As a lot of things that happen in our society, things tend to trickle down. So we start with professional leagues, and they go to college and high school and youth, and it trickles down. So youth has not really been tapped into very well, and it's something we need to do a better job of researching on, and we're attempting to do that now. Next thing I want to talk about is the media and concussions, and how the media portrayal of concussions has affected our overall awareness of concussions. One of the most recent things that came out is Concussion the movie with Will Smith in it, and there's a picture of him on Sports Illustrated right there. This was a great movie, and it's a movie I saw, and many of you in this room may have seen it, but it was a great movie talking about concussions and what happened, and particularly it related to the Pittsburgh Steelers and some of the concussion injuries that happened with some professional players in Pittsburgh. I'm sure you've heard of Mike Webster, and there's some other ones that have happened before. So concussion is in the spotlight, and everybody knows about it and sees about it and talks about it. Or if you go to social media, you look on Facebook or Twitter or any kind of mechanism that's used today, you'll see ways that people tweet articles or tweet pictures or images of somebody getting a concussion and what happens to them. Television, you'll see concussions all the time. Pretty much every game that is played in a lot of sports are now on TV. Used to be, years ago, we didn't see concussions very often. Now, because we see just about every game, whether it's through the internet or TV or whatever the case may be, we see a lot of those concussions. And I remember back a few years ago, ESPN used to do a segment about big hits in the NFL, and that was one of the most popular viewing sessions and viewing times, just to sit there and watch. So concussions and big hits is something we all like to see, kind of thing. But actually, we're going to talk about how it can really affect our children and why it's important to us. And then also journalism, any kind of newspaper blogs, anything like that, you see stuff about concussions all the time. All right, so some basic areas. There's many signs and symptoms. We kind of classify them in 4 different areas. We classify them in physical, all right, in a cognitive fashion, in an emotional fashion, and then in a sleep area kind of deal. So physical symptoms, you're going to see the normal things you'll know. They'll complain of a headache. They'll complain of being nauseous, dizziness, visual issues, and they'll complain of being tired. Okay. Cognitive issues is when you're mentally foggy. You're just not really there. You have difficulty concentrating or remembering, and you're kind of confused or slow in your response or reaction time. Emotional instances are when you become irritable, you become sad, you have more emotional or more nervousness, and that can happen after concussion. And then the last area that we're going to talk about is sleep, which is when your drowsiness, when you have a hard time either falling asleep or sleeping more often than you normally do, and you have just difficulty with that concept of doing your normal activity. All right. And then another thing that we've learned recently, and I'm doing an impact course right now that talks about the trajectories of concussions, and there's different trajectories, and I'm not going to go into that in specifics today, but talking about visual motor, oculomotor, different things like that can affect how we react and respond to a concussion. So those are some signs and symptoms that we all should probably be familiar with, know a lot of them, but some of them you may not know. But those are normal signs and symptoms of a concussion. All right. So how does it occur? We talked about this briefly. It occurs from a direct blow, but it can also occur from a whiplash, a movement of the head, or even a rotational force of velocity. And since we're talking with soccer coaches, most people when they hit the ball, we teach people to use your legs and use your body and absorb the impact and come back off. But a lot of times when you actually see high-level soccer players hitting the ball, there's a rotational force and a component of heading. You don't just head it like this. You head it and you whiplash your head and you rotate your neck and head, and that contributes to concussion. All right. Concussions also occur in all sports, not just contact sports. Obviously, the prevalence and incidence is higher in your contact sports, such as football, hockey, rugby, and so on. But they're also high in soccer and sports like basketball as well. Concussions occur in both males and females. Now, a lot of your research will tell you that females playing the exact same sport with males have a higher incidence rate than males. But a lot of your concussions depend on what sport you play, what position you play, and the type of player you are. That contributes to you having concussions. One important thing to note, particularly for soccer coaches, is in female soccer, that's the #1 sport for increased concussion risk. For females is soccer. Okay, and then risk factors include our past history, which it does in just about any injury. All right, and then we have a greater chance of concussion, a greater chance of symptoms and prolonged symptoms. The more concussions we have, the more severe we have, or the higher number of signs and symptoms that we have. And we also develop mood or learning or disabilities such as attention deficit disorders and migraine headache. That also complicates the management of concussion. So, a very important point is if you have a child who takes ADHD medicine or has migraine headaches and has to see a neurologist or special like that, when they suffer concussion, their management may be a little bit different. So that's something that's important to notice. All right, here's a few pictures of a concussion. The picture on the left is just somebody who without a helmet or without any kind of protective equipment. And the picture on the right is of somebody who has a helmet on. Okay, so briefly, without going through all the points on each of these slides, on these pictures, basically when you have a concussion and you have an impact, all right, it pushes against the skull. So that's #1 on the picture on the right. All right, your skull kind of rebounds going backwards. All right, and then when your skull tends to twist somehow through that mechanism kind of thing, and that's how a picture of what a concussion looks like. It's not just, oh, I got a bruise right there on my head where the ball hit me. Okay, your head shakes and your skull shakes inside when a concussion happens. So there's a little picture of anatomy of what a concussion looks like. All right, so what does this mean to us and why do we care about it? All right, concussion is a silent and invisible disease. Different people have termed it different things. We may not hear or see or know the signs and symptoms right away because sometimes they're not necessarily visible, okay? So it's a tricky thing, and it's something we've got to very much be aware and cognizant of when we have a concussion. It creates neural dysfunction, all right? It creates possible cell death. Again, I don't want to go into details and specifics with you about all that, about what happens inside the brain when that happens, but it can create cell death. It can create behavior issues. It can create learning and thinking impairments. And it just overall affects the ability of a child or anybody who suffers a concussion to successfully maneuver through life, kind of deal. One big point, an important point that we need to be aware of, particularly in the young age group that we are talking about today, is the second impact syndrome, or the post-concussive disorder. Basically, that is when you have a concussion and you don't let your brain heal properly by sitting out, by resting, by getting the proper management of that concussion. You go back too soon, even the slightest thing can cause another concussion. That's a second impact syndrome. And that second impact syndrome can be severely disordered and much more hard to deal with than just a normal concussion. So that's an area we worry about, particularly in children, because a lot of times children, they don't know how to describe it very well. They don't know, they don't speak to their parents or speak to their coaches very well. So sometimes it can be a hard thing for us to diagnose. So second impact syndrome is important for us to understand and be aware of. All right, so what do we do when we have an athlete, we're at soccer practice or we're at soccer game, whatever the case may be, we have an athlete who has a concussion. All right, what do? Immediately we stop them from playing. Okay, that's the first and foremost important thing. We don't just bring them out of the game and say, hey, are you okay? And have them follow your finger and balance like we see some people doing. And if they do okay with that, let them go back in the game. What we do, we immediately remove them from play, take them out of the game or out of the activity, and we need to call their parents or their legal guardians to inform them of what's going on. We want to ensure that the child is going to be evaluated by a licensed healthcare provider, somebody who is trained in concussions and how to treat a concussion. All right. Want to make sure there's no same-day return to play. All right, and we want to properly monitor using a multidisciplinary approach. We want multiple people involved. We don't just want the head coach involved and that's it. You want the parents, you want the teachers at their school, you want their doctors, whether that be their pediatrician, their neurologist, whatever the case may be. So you want a lot of different people involved to help manage this client. And we also want to look at the signs and symptoms, which we've already gone through. We need to have that checklist. We need to have neuropsychological testing. And there's all kinds of apps and techniques and programs that are out there. So, and I listed a few up here. The SCAT-3, the SAC test, the King-Devitt test, which we have actually started doing at Southside High School this year. And the impact test are some of the programs that are out there that help with concussion management. All right. Pediatric concussions. That's why we're all here today. We all coach youth soccer athletes, ages 5 through 10 is kind of the target audience. Pediatric concussions. How are they different than adult concussions? And believe it or not, they are different. A lot of research we have is obviously geared towards the adult. But research has shown that recovery in children and adolescents may take longer. Okay? May take longer for them to heal. We want to use age-appropriate validated tests. I mentioned some of the tests that we use as in the SCAT and the impact a little bit earlier. There is an age-appropriate test called the Child SCAT-3. It's geared towards children. That's one of the few tests that's geared toward children, but you want to use an appropriate test. You want to have assessment and plan should be obviously using a multidisciplinary approach like we've already talked about, okay? That should include not only the parents and the guardians and the coaches, but it should also include the teachers, the administrators, anybody who helps care for that child. That's important for them to know that a concussion is involved in their care right now. Continual brain cognitive and development demands that you have a different plan for a child. A child is still learning, growing, they have cognitive development, and that's still part of their growth. And it's important that you guys as coaches understand that that demands that we treat a concussion in a child differently than we treat a concussion of a 25-year-old, female soccer player or whatever the case. To play, those are to play are, but that should be a part of our concussion management plans, because if we don't include those in how we manage a concussion, we're doing a disservice to that athlete, because that's important to how they get back to what they need to do. And then last thing, I've already mentioned this earlier, the second impact syndrome can be a fatal thing, and it's a very important thing that we need to be aware of and understand. All right, a couple current issues that are important to us that I hope is something that you guys will all pay attention to. And number one, I know you have paid attention to this because I've talked with Scott, who runs the CUSA League, and he's actually invited me to speak here today. I know that we are, due to what the U.S. Soccer Federation is doing, the CUSA League is banning heading of the ball in age groups of under 10. Both of my children play in an under 10 league, and I know that U.S. Soccer Federation has mandated that for under 10. And for leagues 12 and under, age groups 11 to 13, the U.S. Soccer Federation has limited that heading kind of thing. So U.S. Soccer Federation has made some changes to their rules, and that's something that we're all going to probably see over the next few years and coming years as we develop in what concussion is and how we can manage it. We may see some rules changes. And remember, these rules changes are not to destroy the game or limit the game, but they're to increase the safety of the athletes who play. So the U.S. Soccer Federation has done some great work in this area. Another great program that I really encourage all you to do, and speaking with Scott, I know some of you guys are required to do this. It's the Heads Up program in concussions and youth sports. It's a CDC program. Listed up there, I have the website. That is a brief training program. It takes you through basically what I've gone through today with some questions and some actual real-life situations to help you understand and facilitate your learning. I actually have done this program, online training. It does not take very long at all, and it's very simple and to the point, but it makes you understand and be aware of what a concussion is and how you can affect your athletes as you do this kind of thing. So in closing, I just want to have a few take-home points that I want you to really pay attention to and hope you kind of picked up from our talk today. First of all, concussion is a rising epidemic. It's very prevalent in society. Everybody knows about it, talks about it. And so it's something that you guys as coaches and myself as parents, as an athletic trainer, whatever the case may be, it's important that we know and understand what a concussion is and what we can do with a concussion. I want us all to look at management plans and develop one if we don't have one. I put in parentheses the CDC Heads Up program, which all you guys are going to be doing. I really urge you and hope that you guys look at management plans and have a plan on what to do if a concussion happens. You want to have a team approach when you are dealing with concussions. I mentioned this earlier in our talk. It's not just one person handling a concussion, it's a bunch of people, so it allows the best care for that child. All right, there should never be a cookie-cutter mentality to a concussion. Not every concussion is the same. Where there's different risk factors, different ages, different things like that. So there's no one way to handle a concussion. There's no one best way. And you've got to be willing to adjust and monitor and see what needs to be done in order to have the best care for this type of injury. All right? And then lastly, and most importantly, is have a documented plan and follow it. Don't just learn about it and not do anything about it, not follow through if you happen to have a concussion. So that's something that's extremely important to do. I'm going to put my list of references up as I talk to you. I'll kind of flip through some references. I don't want to bore you with different references, but I have a few pages of references where I've got my material. But in closing, I just want to say I just really hope that all of us have the knowledge and the education to understand what a concussion is. It's very important in not only the health of the athlete, but the lifestyle of the athlete. If they continually have suffered concussion after concussion and don't get the proper care and management for it, it makes a tremendous impact in their life later on, kind of thing. So it's very important to have a concussion plan and an activity, and to know how we can treat a concussion. So with that, I want to thank you guys for allowing me to come out and talk today, and I will take a minute and answer some questions. At the end, if you have any, you're welcome to come up and talk to me. And I want to thank Scott and thank CUSA for allowing me to come out today and speak to you guys. Thank you very much. And the last thing I wanted to talk about today, what goes along with documentation and following it, I gave you guys a couple handouts. One is a concussion information sheet for CUSA youth soccer. Goes through some basic signs and symptoms, a little bit of a checklist, some things of what you should do when you expect a concussion. So I want you to have this, and it would be a really good idea to give this information sheet to any of your athletes, players, families, coaches who suffer a concussion. And then the last thing is I have a little concussion exposure form. This is something that you keep whenever you have one. There's a place for you to document what happened, who it happened to, name, date, description of the injury, different things like that. And then at the bottom there's a place for you to sign and date kind of deal. But both of these sheets I wanted to include in my presentation and hopefully allow you guys to see these and use these in preparation of your concussion management plan. Thank you.